Maria is a 58-year-old Hispanic female diagnosed with COPD and emphysema. She was previously a first-grade teacher but was forced to resign due to dyspnea when teaching. Currently, she is tutoring and caring for her mother and grandson. She is worried about her financial instability, and her current meaningful occupations include spending time with her family, socializing with a retired teachers group once a month, teaching Sunday school at her church, cooking meals for her family, quilting, and flower gardening. Though Maria feels lonely and burdensome to her friends and family, she is very thankful for their support. Current symptoms related to her COPD include dyspnea with activity exertion, walking further than 250 feet without a rest break, housework, shopping, walking upstairs, preparing meals, bathing, and prolonged conversations have been progressively declining. She continues to be as independent as possible in her familiar roles as well as her ADLs and IADLs. The key occupational performance issues include limited financial resources, decreased endurance during ADLs and IADLs, decreased social participation in leisure activities, feelings of frustration, anxious, self-conscious, helplessness, loneliness, and doesn't want to be a burden, difficulty managing breathing/education on breathing techniques, requires education to use and manage oxygen supplies in her home, inability to delegate home tasks to others, lack of energy conservation techniques, home modifications, and difficulty sleeping due to anxiety. Maria has several strengths and resources, including family support, her work determination, leisure activities, church support, friendship support, home maintenance determination, financial support, and recent referral resources. She has had a consultation with a dietitian, and she has been referred to advanced home care for oxygen supplies, and these supplies are delivered to her home when needed. The social cognitive theory is one of the most widely used behavior change theories applied to the management of chronic conditions such as COPD, because of the emphasis placed on self-management and self-efficacy. Programs focused on self-management build self-efficacy by educating the client on problem-solving, decision-making, action planning, and behavior change. Interventions guided by the social cognitive theory can provide clients the skills to have control over their conditions and manage their health in order to improve quality of life. The occupational therapist can teach Maria strategies on how to self-manage the emotional stress and daily consequences of living with COPD, which will improve her self-confidence and help her regain a sense of control and independence in her breathing, anxiety, energy levels, and performance in daily activities. Maria's long-term goal includes, with assistance from the OT, Maria will develop and implement a daily energy conservation plan that includes breathing techniques to be utilized throughout the day to increase overall performance in ADLs and IADLs and improve functional mobility within 1 month. Short-term goal number 1. Maria will demonstrate the ability to manage her oxygen supplies independently in order to enhance her abilities to care for her grandchild and perform her role as a tutor by 10/5/16. Short-term goal 2. With encouragement from the OT, Maria will identify and demonstrate 3 ways that she can reduce her anxiety and control her breathing in order to improve her sleep at night within 3 sessions. The Rhode Island Stress and Coping Inventory is comprised of 12 items that describe perceptions of one's current stress and coping skills. It will determine if Maria perceives that she is coping effectively with her stress. The results will enhance her self-management skills and reduce her emotional stress in order to participate in her desired daily activities. The assessment of living skills and resources determines an individual's ability to perform IADLs and assist in identifying needs, assigning risk of disability, and prioritizing interventions. It consists of a checklist that has 11 functional tasks. The results will determine the potential areas of concern for Maria and provide insight into the skills and resources that she possesses or needs. The appropriate intervention approaches for Maria are the establish, restore, and maintain approaches. Maria will establish new skills and abilities and restore prior skills to enhance her ADL performance. This will also help Maria maintain performance capabilities to meet her occupational needs. OT visits initially scheduled for 1 time a week for 1 month and can be later adjusted based on needs and progress. Maria is limited in participating and completing her daily activities due to her dyspnea and lack of energy. The main focus of her intervention plan is for her to learn deep breathing techniques and energy conservation strategies from the occupational therapist in order to perform her daily occupations safely and efficiently and to reduce her anxiety, which makes her breathing problems worse. The occupational therapist can teach Maria deep breathing techniques that she can utilize at times when she is feeling anxious or short of breath. One of these techniques is called pursed lip breathing. It includes inhaling air through the nose, pursing or puckering of the lips, then gently exhaling through the pursed lips. This technique has been shown to prevent tightness in the airway by providing resistance to expiration, as well as increasing the use of diaphragm and decreasing accessory muscle recruitment. The second breathing technique the occupational therapist can teach Maria is diaphragmatic breathing. This technique calls for increased use of the diaphragm to improve chest volume. It can also be used in conjunction with pursed lip breathing. The OT can work in collaboration to incorporate energy conservation strategies into Maria's daily routine. One energy conservation strategy that is important is time management. The OT can sit down with Maria and design her schedule to ensure tasks requiring high energy expenditure are interspersed with lighter tasks and rest breaks throughout the day. The OT can also ask Maria what time of day she feels like she has the most energy and center occupations around that time. First and foremost, the OT can work with her to develop daily routines for managing her oxygen equipment. This includes regular checking to see how much oxygen she has left, replacing tanks when empty, and managing flow rate settings. It is also important to educate Maria on the importance of taking her supplemental oxygen. Supplemental oxygen therapy has been shown to improve exercise tolerance, quality of life, and reduction in hospitalizations in patients with COPD. There are many community resources and organizations, associations, and support groups available for Maria and her family to access online. They also provide education, prevention, rehabilitation, research, and disease management for individuals with COPD and allow her and her family to connect with others and share ideas and experiences of living with COPD.